Have you ever wondered about the intricate connections within your brain and how even small changes might impact its function? Sometimes, when we hear about a brain lesion, it can sound alarming, especially when linked to conditions like epilepsy. But is every lesion a direct cause for concern regarding seizures? The direct answer is no. Brain lesions do not always cause epilepsy. While some lesions are indeed a primary cause of seizures, many others exist without ever leading to epilepsy or any other neurological symptoms. The why behind this lies in the complex architecture and electrical activity of the brain. A brain lesion is essentially any area of damaged or abnormal brain tissue. For a lesion to cause epilepsy, it typically needs to disrupt the normal electrical signals in a way that generates uncontrolled, abnormal bursts of activity. This often happens if the lesion is located in a functionally critical area, or if it creates what is known as an epileptogenic zone, an area of the brain with an increased tendency to produce seizures. Factors like the lesion's size, its specific location, and the type of lesion are all crucial. For example, a small, stable lesion in a non-critical area might never cause an issue, while a lesion that causes scarring, known as gliosis, can sometimes irritate nearby brain cells, making them hyperexcitable and prone to seizure activity. So, how does this impact you or a loved one if a lesion is discovered? If a brain lesion is identified, typically through imaging like an MRI scan, a neurology specialist will carefully evaluate its characteristics. They will consider your medical history, any symptoms you may be experiencing, and potentially conduct an electroencephalogram, or EEG, to measure brain wave activity. This comprehensive assessment helps determine if the lesion is actively causing or has the potential to cause seizures. It is also important to understand that lesions are diverse. They can be due to various causes such as a stroke, a previous injury, an infection, a tumor, or even developmental abnormalities present since birth. The brain's remarkable plasticity also plays a role. Sometimes, the brain can adapt and reroute its electrical pathways around a lesion, preventing it from becoming a source of seizures. This adaptive capacity is one of the many fascinating aspects of our neurological system. Ultimately, the presence of a brain lesion is a significant finding that always warrants thorough medical evaluation. While not every lesion leads to epilepsy, understanding the specific nature and location of any identified lesion is key to managing your health and determining the appropriate monitoring or treatment, ensuring you receive the best possible care for your unique situation.